Hey everyone, I'm River, and this is my case study PowerPoint for ethical decision making and social work practice. So, some of the case study details: Jordan, 18, and David, 21, are young parents to 6-month-old Maya, who moved to a new province without any family or community support. There's quite an age gap between parents, considering Jordan's age of 18. Jordan, David, and Maya are a low-income family living in a bachelor basement suite. There's lack of furniture, food, income, employment, medical support, resources, and community support for the family. Both parents are unemployed and face barriers to employment and financial security. Jordan and David often fight. It has been noted that David has a hard time sustaining employment due to his anger management and physical altercations with other employees. The police have been called due to the couple's ongoing fighting. The police reported the couple to a social worker due to the condition of their living arrangement. They stated it was dirty, smelled of soiled diapers, there was minimal food, and a 6-month-old child Maya living in these conditions. When the social worker arrived the first time, the house appeared to be more organized. There was food, formula, and diapers. However, Maya cannot hold her head up on her own and has not been to a pediatrician since she was born. The parents tell the social worker they will make an appointment for Maya in the next 2 weeks. When the social worker arrives the second time, 2 weeks later unannounced, the house is dirty again, it smells like marijuana, and the parents appear intoxicated. Red, glossed over eyes and laughing. Maya is still sleeping at 11 a.m., and the pediatrician appointment has not been made to address Maya's health concerns and needs. When the social worker asks both Jordan and David why Maya is still sleeping, the parents laugh and state that she's a great sleeper. So, some important questions to ask regarding this case study. There needs to be a safety assessment done for Jordan to see if there's domestic violence present in the relationship, considering David's ongoing anger management and past physical altercations, the couple's fighting, the phone call to police from concerned neighbors, the lack of family and community supports, and lack of resources to employment, finances, basic human needs. I would like to ask, what are Jordan and David's positionalities? Are there barriers to healthcare, resources, employment, schooling, funding? Does the social worker need to prioritize cultural safety, traditional and holistic ways of healing, resources, and community supports? Why did Jordan, David, and Maya move provinces? What are the roots of their marginalization and barriers being faced? Why has Maya not been to the pediatrician? Does Maya have any current known health concerns? Is there barriers to healthcare? Is the family not informed of baby's healthcare needs? There may be some lack of education with infant care. Should the case remain open? Yes, the case needs to remain open to ensure Maya's safety. The social worker must identify if the family is willing to create a voluntary plan of action and family conference, followed by reassessing the situation to ensure safety for both Maya and Jordan. We need to create family-centered goals, advocate for culturally relevant supports, resources, and funding needed to support the entire family. Maya's health, safety, basic needs being met is obviously the top priority. Addressing the barriers faced by this family, creating long-term solutions to the barriers and marginalization faced will also follow. Acknowledgement of any cultural and traditional healing supports is also a priority within the family-centered planning. So the actions needed. In Child Protections Division 1, responding to reports, Section 16 outlines that a social worker must protect the child from harm, serve the best interests of the child, take into account the wishes, needs, and role of the family, and take into account the child's culture and community. So if the family consents to a family conference, in Legal Aspects Division 2, Cooperative Planning and Dispute Resolution, a family conference in Section 20, the family conference assists the family in creating a plan of care that will protect the child from harm, serve the best interests of the child, examine the needs and role of the family together, and acknowledge the child's cultural and community. Plan of Care Section 1 states that the plan of care developed in collaboration with the family and the social worker is to create an outline of services and resources needed to support the family and child's safety. The plan of care may include provision for one or more of the following: the child to reside in a home of a relative or other person, a person including a parent to reside outside the child's home, or the director to have access to the child. So this is kind of worst case scenario. Services needed to support the family. Young parents group, cultural and traditional safety programs and resources, safe and affordable housing, financial aid and food security, couples and individual counseling, anger management, parental skills, shelter for Jordan and Maya if domestic violence is present, doctor's appointment for MAEA, support with transportation and advocacy, employment programs, education and training support, substance use support if requested, and definitely widening the circle of care, community integration, holistic supports, outreach support workers. And in the case, if the family refuses a family conference and assistance, the BC Child and Family and Community Service Act states that parents are responsible for their child's health and safety. If this is neglected or refused, social workers must immediately report and act. In Section 13, a child needs protection in the following circumstances: if the child has been or is likely to be physically harmed by the child's parent, if the child has been or is likely to be physically harmed, sexually abused, or sexually exploited by another person, and if the child's parent is unwilling or unable to protect the child, if the child has been or is likely to be physically harmed because of neglect by the child's parent, and if the child is emotionally harmed by the parent's conduct or is living in a situation where domestic violence by or towards a person with whom the child resides. Also, if the child is deprived of necessary health care, if the child's development is likely to be seriously impaired by a treatable condition, and the child's parent refuses to provide or consent to the treatment. And lastly, if the child's parent is unable or unwilling to care for the child and has not made adequate provision for the child's care. And if the family refuses, or if the child needs immediate protection, so finding out if the child needs protection in Section 16, when a social worker receives a report under Sections 14, 15, or 27, they must decide to refer the report to another director, or if the child is an Indigenous child, to an applicable Indigenous authority. Section 1.1 also states that the social worker must not make a decision to refer the report as set out in subsection 1b, unless the Indigenous authority confirms that Indigenous law applies to the child, and further, that the Indigenous authority will take over and assess the reported information. After this assessment, the social worker can offer support service and agreements to the child and family, refer the child and family to any of the following: a community agency, in the case of an Indigenous child, an Indigenous authority or community, and any person the director considers appropriate. So some code of ethics principles. Value 1, respect for the inherent dignity and worth of persons. Social workers demonstrate respect for the right of every person to participate in making decisions in all matters affecting them based on informed consent, consistent with their capacity while considering the rights of others. When services are mandated, we need to advise them of their rights and responsibilities regarding the purpose, extent, and nature of the social work service being offered. And when services are not mandated, we need to advise the family of their requirements to record information and their right to access their professional records. Working in partnership with service users by acknowledging they are experts in their lives, promoting their well-being and active participation in decisions about goals, alternatives and service options, limiting those rights when their decisions or actions pose a serious, imminent, or foreseeable risk to themselves, others, or when this is needed to protect them from being harmed by others. And we need to take the steps required to ensure they have access to all information and resources necessary to participate in decision-making. So my action looks like, it is essential for social workers to include the voices, agency, and consent of both parents and the family planning to prevent further harm. This could look like the perpetuation of individualized blame and punitive outcomes. It is also social workers' duty to provide the family with accessible, accurate, and safe information and resources that fit the unique needs of the family. As a one-size-fits-all model of care has been shown to fail and silence folks, especially marginalized families. Social workers also hold a responsibility to limit rights of promoting parent self-determination when parents' decisions or actions put children's safety in harm's way. In this case, if Jordan and David's decisions neglect Maya's health, safety, and basic needs, I hold an ethical responsibility to make decisions to protect Maya on my own account. So value number 2, promoting social justice. 2.1 states that social workers uphold the principles of social justice related to the rights of individuals, families, etc., to receive fair and equitable access to services, resources, and opportunities, and to be free of oppression, racism, and discrimination. 2.11 states that fair and equitable access to public services and benefits for all people, particularly those most in need, including those with varying abilities. 2.13 states that the rights of all people to have meaningful participation in decision-making in accordance with their abilities and taking into account their racial, ethnic, linguistic, spiritual, and cultural needs. So my actions here, I hold a responsibility to best serve this family by listening to the family and acknowledging the barriers and oppression in their life and committing to dismantling these barriers. This could look like finding safe, culturally relevant, and accessible services, accompanying them to appointments and resources to help them understand the process and validating their concerns. It could look like helping them understand medical language that might present as a learning barrier and giving them agency in their decisions that might be discredited in the medical system. Because, often the medical system can view professionals as the expert, discrediting and invalidating clients' voices, intersectional identities, and needs. Pursuing truth and reconciliation. In the case that one of the parents is Indigenous or both, Guiding Principle 3.1 states that social workers need to uphold the values and principles of reconciliation. We need to learn the history of Indigenous peoples and colonialism, the impact of residential schools, and the enduring intergenerational impact on individuals, families, and communities. We need to develop insight into the social work profession's historical role in colonialism and ongoing discriminatory practices. We need to understand intergenerational trauma and the resulting impact on cultural, language, and identity with families and communities. Engage in allyship through building trust, respectful relationships, and developing solidarity with Indigenous people. We need to advocate for institutional and systemic changes in education, child welfare, health, and the justice systemic change. So my actions here: if one or both of the parents is Indigenous or a person of color, I hold a critical duty to acknowledge the ongoing actions of genocide in the child welfare systems and how displacement, oppression, violence, and harm continue to threaten families of color due to colonialism, assimilation, dehumanization, and theft, all of which are rooted from the Western agenda. I also hold an ethical obligation towards acknowledging their cultural and traditional ways of knowing and doing and implementing this into our family goals. I must acknowledge that building safe and trusting rapport with this family is the way in which I will be able to advocate and serve this family effectively. I also hold a responsibility towards standing up to systemic inequalities that this family may be presented with, causing their oppression and marginalization. Importantly, I hold a responsibility to provide professional supports that align with their cultural knowledge system. Value number 4, valuing human relationships. Social workers place the well-being and interests of all people at the center of their relationships. So I need to demonstrate compassion, respect, trustworthiness, and being non-judgmental. Showing respect and value for service users' experience, working in partnership with service users when planning services, and providing interventions and advocating on their behalf. Another guiding principle here is social workers continue to develop self-awareness and practice self-reflection to guide their practice and personal well-being. I need to develop awareness of their own personal beliefs or moral positions, mine, and ensure they do not take precedence over a service user's rights and best interests. So my actions here: I hold a responsibility to meet the family where they're at in their journeys and implement a family-centered approach towards supporting this family and meeting their unique needs. Learning and listening to this family will not only build trust and safety in our working relationship, but it will also facilitate an opportunity for the parents to speak on their strengths and knowledges. I also hold a responsibility to engage in critical self-reflection throughout our working relationship, to face humility, honor room for growth in my practice, and acknowledge that the family is in the best position to advocate for what they need, as long as Maya is not an immediate risk of neglect and harm. And maintaining privacy and confidentiality. Social workers uphold the interests of service users, members of the public, and other professionals in developing and safeguarding the trust placed in the confidential relationship. Considering the values, customs, beliefs of service users and how they wish confidentiality to apply within their cultural context, providing service users accurate information regarding who will have access to the records, the right to seek avenues of complaint, and the limitations of confidentiality. So my actions here: I hold an ethical duty to address clear and concise confidentiality policies and limits to the family in a way that they both understand and can consent to. I also hold a responsibility to share information with people in community services only at their request, example, through an ROI. I also hold a duty to report accurate information on the family and discuss what a breach of confidentiality means and would look like. Example, if the family poses an immediate danger to self, others, or abuse and neglect to Maya. So some value tensions here. In value number 1, respecting the dignity and worth of all people. Social workers uphold each person's right to self-determination, inclusion, and decision-making consistent with the person's capacity versus limits to self-determination due to possible harm and neglect towards Maya. In 1.2.6, working in partnership with service users by acknowledging they are experts in their lives, promoting their well-being and active participation in decisions about goals, alternatives, and service options. However, there are limits to this if Jordan and David's decisions or lack of engagement in the decision-making process imposes harm to Maya. And in confidential information, so something legal here in Section 24, a person must not disclose or be compelled to disclose information obtained in a family conference, mediation, or other alternative dispute resolution mechanism. However, if the disclosure is necessary for a child's safety or the safety of a person other than a child, or is required under Section 14, so some legal considerations here. In terms of Maya's safety, I have several key concerns relating to her safety, which outlines when protection is needed, including the following from Maya's circumstances. So if there's likelihood for the child to be physically harmed by parental neglect or has been, if the child is prevented from accessing health care, and if the child is living in a situation where they are victim to or exposed to domestic violence. And in value number 4 here, valuing human relationships, social workers place the well-being and interests of all people at the center of their relationships. However, best interests of the child. In Section 4, where there is a reference in this act to the best interest of the child, all relevant factors must be considered in determining the child's best interests, including, for example, the child's safety, the child's physical and emotional needs and level of development, the importance of continuity in the child's care, the quality of the relationship the child has with the parent or other person, and the effect of maintaining that relationship, and the child's cultural, racial, linguistic, and religious heritage. So although I want to collaborate with the parents, if they're not consenting to working together or they're just completely uninterested in it, I have to take the best interest of the child in my work practice, other than collaborating with the family if they're failing to want to participate in this. So some priorities and obligations to meet and justification for actions. I need to ensure Maya's safety. We need to make a doctor's appointment. I need to, do a safety observation for domestic violence, harm towards her, abuse, lack of essentials she needs to survive, such as food, infant supplies, love, and attention. We need to ensure Jordan's safety. We need to rule out domestic violence. We need to create a consensual and self-determined family safety and wellness plan. I need to acknowledge the barriers being faced by this family. I need to advocate for safe, culturally relevant, appropriate, and accessible supports. Maybe look into safe and affordable housing options as they're living in, a basement suite right now, a studio basement suite. We need to assist with community involvement supports and groups so they're not so isolated. We need to support with financial aid, employment initiatives and training, food security, and infant supplies. We need to create long-term solutions, not just immediate Band-Aid solutions, although safety is the immediate priority right now for Maya and Jordan. We need to implement these supports using a family-centered, holistic, strength-based, anti-oppressive, and social justice-driven lens. We need to allow the parents to hold agency and autonomy in the decision-making. We need to allow the parents to tell their stories, validating their concerns and barriers being faced. We need to meet the family where they're at. We need to widen the circle of care. We need to acknowledge neoliberal biases that focus on weaknesses and use a risk-based lens, often placing full blame on individuals instead of critically examining roots and systemic inequalities that shape oppression. We need to explore the family's sociocultural, historical, political, and economic context and consider the systems of power and oppression in place. So some social justice implications. Decolonization. So I'm working in a relationship to disrupt colonial oppression and control while fighting towards cultural regeneration and sovereignty. and highlighting the importance of community and cultural importance in people's well-being, identity, and relationships. Decolonization also highlights the importance of working from clients' and families' worldviews and educating myself on ways to center the realities and experiences of the folks I'm serving. Intersectionality. Questioning the normative constructs and its relationship to social categories and systems of privilege and oppression, while exposing the racism, whiteness embedded in the healthcare policy and actions that shape these inequalities. I use intersectionality to transform my practice by examining my own positionality, social position, and my relationships to the system of oppression that I work in, while also questioning the false ideas that oppression and health disparity are an individual failure and exist in isolation from systemic and societal influences. Self-determination and agency. It is critical we work from our clients' strengths, knowledge systems, and include them in the decision-making process. If we are not providing this space for client agency, then we are perpetuating the system of control and power hierarchy that creates further marginalization and surveillance. Critical self-reflection. Critical consciousness, ongoing learning and unlearning, facing humility, acknowledgement of positionality and privilege, questioning my motivations when working alongside folks, specifically marginalized folks. Collaboration and solidarity. We need to engage in social justice collectively, learning from others' experiences and worldviews, and holding each other up while doing this work. Working in solidarity involves continuous engagement with those who are marginalized and being able to create a safe and supportive space to enable individuals to share their stories and allowing their voices to be heard and validated. Cultural safety and health equity. Advocate for appropriate, safe, and accessible services. Everyone's needs, stories, and identities are unique. However, the systems in place, along with the biomedical model, assumes everyone's needs are the same, which places folks into a one-size-fits-all modality of care. This removes people's agency and ignores the historical and ongoing displacement of folks with intersectional identities. Throughout these systems that construct cultural privileging, the racialized other, and the normalization of the nuclear heterosexual family. My ethical self-assessment looks like, so what are some of my prejudgments that I bring to my work as a result of my personal and cultural history? So as someone who does not have children and have friends and family who are survivors of domestic violence, I would need to ensure that I check my biases to prevent power over the family, further harm towards the family, assumptions towards David, and assumptions regarding barriers to childcare and supports. I would need to do my research and learning and unlearning to ensure I best serve and support this family. How does my positionality conflict with this scenario? As a queer non-binary individual who does not have children and as someone who holds privilege with education and a position of power, social worker, I would need to address power differentials, differences in identity, and acknowledging the overlapping barriers the parents could be experiencing in supporting Maya and themselves. I also need to acknowledge the historical and ongoing impacts of the child welfare system and identify how this could impact myself and the family's trust and working relationship, and the possibility for ongoing family displacement and oppressor power relations. So, resolution. If the parents consent to a voluntary family conference and plan of action, rule out domestic violence, using a family-centered and anti-oppressive approach, work alongside the family to listen to their stories, needs, goals, and barriers being faced. Assist the family with making a doctor's appointment for Maya. If needed, we need to implement support and accessibility. Example, an outreach worker to help get them there. To help with the doctor's visit, advocate at the doctor's visit alongside the family, and transport them if that's an issue. Safe and affordable housing, food, clothing, furniture, hygiene, essential supplies. This could look like food bank, community resources that support these. Work on financial security. Government subsidy, low-income supports, employment, and educational supports could be provided. We need to work alongside the family to create short-term and long-term goals. Create a schedule to meet and support the family, example, every 2 weeks. If goals are being met, scheduled meetings will reduce. I do not want to impose surveillance if this is not necessary, as it can create more harm and discredit folks' rights to self-determination. This is especially important when working alongside families of color and marginalized folks who are continuously surveilled by the child welfare system. Community supports work to reduce isolation and create a sense of belonging and connection. Meet the couple's individual and collaborative goals, i.e. hobbies, young parents group, culturally relevant supports, recreation passes, bus passes, etc. Harm reduction and substance use programs if they're interested in these. Counseling, family supports, and healing supports. If Maya has health or developmental challenges, assist with supports for these, i.e., therapeutic programs, specialists, education for parents, meetings for parents so they don't feel so isolated. And lastly, if Jordan and David do not consent to a plan of action neglects Maya's medical needs and safety, I would need to inform the parents of their rights and my duty to report to Child Services. If possible, I need to contact a family member to see if they can care for Maya while a different plan of action is being addressed. It's best that Maya stays in the family so we don't perpetuate, the intergenerational cycle of surveillance and displacement and theft. If no other family member is available to care for Maya, ensure she is placed into care of a culturally relevant and safe space, where all her medical, emotional, physical, and spiritual and cultural needs are met. Continue working alongside the family to eradicate barriers, educate, create goals, and heal so they can work towards caring for Maya in healthy and sustainable ways. And here are my references. Thanks so much, everyone.